Welcome to the CereCore podcast, where we focus on the intersection of healthcare and IT. From practical conversations to strategic thought leadership, let's unpack the decisions, challenges, and journey of those whose purpose is to deliver technology that improves healthcare in their communities. Today, Shahzad Fakhar joins us on the CereCore podcast. Shahzad is a healthcare technology and executive operations leader with HCA Healthcare and serves as vice president of field operations within the information technology group. Well, Shahzad, thank you so much for agreeing to participate in our CereCore podcast. We're really excited to have you and to learn a little bit from you today about your journey, some of your insights, and we really look forward to it. So thank you for being here with us today.
Hey, Phil, thank you. Thank you for the invite and look forward to the conversation.
Wonderful. Well, we always like to start these out with just a little bit about, your journey as a healthcare leader. So, you've witnessed, tremendous change in the industry over the tenure of your career and really seen some pretty dramatic change and growth in HCA as well. And so if you could maybe just share a little bit about what that journey's been like for you.
Sure. It's been, you're exactly right. It's been a tremendous journey, 33 years in healthcare IT. And when I stepped into it, I did not know how much change was in front of us. And over the years, I have opportunity to work at a 90-bed hospital to a 700-bed hospital to and serving in multiple divisions in 5 different marketplaces. So needless to say, I've seen healthcare from a small rural 90-bed facility and the influx of technology, which has impacted that 90-bed facility to a transition into a 700-bed facility, specialty care, more metropolitan market driven, and then also fortunate to experience how healthcare gets delivered in the communities itself and how the technology has impacted the collaboration between the community healthcare settings and then in a more of an enterprise setting across the nation, how it has impacted. So yes, it definitely has been an evolution in some cases. And some part has been very revolutionary also to bring the healthcare together.
No, I think that, just that perspective of being so close to the community and then working your way up to a corporate role really gives you some fantastic perspective on what we all try to achieve on a day in and day out basis, which is that, where the rubber meets the road with healthcare, which is not always at the corporate level, but in many instances, it's at that bedside community level. So you bring that wonderful perspective. And, throughout your tenure, I'm sure you've seen just a tremendous amount of innovation, that's taken place in the marketplace and just in healthcare in general. So, maybe share with our audience a little bit about kind of your philosophy, on innovation. What encourages, you or others around you to kind of bring that innovation forward in the healthcare setting?
So first and foremost, healthcare IT is always evolving. And there is a definite need of constantly defining the new normal, as you say, is majority of it in the past has been that we have been driving it internally, but there's a lot of external pressures now which are driving too. So we have to balance that out. And I think the desire of innovation comes internally to make things better in the way we perform them, but externally to deliver better care for the care providers and for our patients also. So there is a new normal which gets defined based on a lot of circumstances which are not in our control. And we have to adjust to that. And innovation plays a big part in us making those adjustments. And if you're not continuously making the change and innovating, it's really difficult to keep up with the pace and the request.
Yeah.
And some of that has to do with overarching consumerization in healthcare also. So the desire is coming from multiple different factors. Is information, the way we process the information, the way we look at the outcomes we deliver through healthcare, and also the impact we provide in our communities from the overall health of the community also. All these things are pressuring us to innovate in all different areas, not just pure care, but the way we communicate that care also, and the way we collaborate also within our own facilities, but external to our facilities also at the same time. So we have to be cognizant of the fact that we have to always think about the way we did the work yesterday is not the way that we're going to perform the work tomorrow. And if that's the case, what are the innovative ways of doing the work for tomorrow? Mm-hmm. And it typically addresses today's problems, but it should also extend into helping us or building on resolving tomorrow's problems, which typically are not clear to us because the environment hasn't changed. And if it changes, mm-hmm. how should we react? It should build up on what we have learned doing the work we did yesterday. Yep. So there's a lot of different ways of approaching, but it's a constant innovation which is needed to make sure we are looking at the work at all different levels.
Now, you make some great points there, Shahzad, and I think, you hit on a couple things. One is kind of laying that foundation for innovation, and that kind of consistent innovation that you can build off on regardless of where kind of you have to pivot. And so I think that sometimes organizations, and we see it, right? Because there's a flip side to innovation, and that's just being static. And there's certainly consequences that go along with that. And I think sometimes organizations get to that static state because they're unsure of the future. And so I appreciate what you said about laying that foundation so that it's always there so that you can take advantage.
Yeah, some of the innovation requires is not just solving a problem, but also investing in preparing to solve the problem. That could come from, tooling, which is required to say what kind of innovation required, what type of effort, and then staff. And most probably sometimes the bigger initiatives, challenges require some dedicated teams to focus on innovating. Because you have to really figure out where you start and how you can build up on it. And you got to have people who have been involved and have done innovation at all various problem efforts level who can think through that. So sometimes the more mature your processes get, the more dedicated you have to get with the tooling and the staffing.
Right. No, that makes great sense. And you mentioned a little bit, around some of the consumerism, certainly with caregivers, patients, their expectations 10 years ago, 15 years ago are radically different than they are today. And as you mentioned, it's continuing to change on a day in and day out basis. Looking at the future, what are some of those big areas of opportunity for innovation that you see today that organizations need to be paying attention to?
Definitely. I think a lot to be done in patient care documentation. I think that's a front and center of accumulating information and then digesting it, presenting it back to all different stakeholders in the mix. So, what does it mean to the caregiver? And, the documentation provide insights from one caregiver to another. So it's very critical that we do efficient job of documenting the care. So it can carry the patient through different care settings, but also provide a lot more comprehensive longitudinal record of their care, which caregivers can look and compare to and make clinical decisions on. Right. I think it's also the patient itself is a very well-educated patient in this new consumer world. So what does it mean to them? for them, it is providing, their care episode information in more meaningful and easy to digest way.
Yeah.
Whether it could be providing them dashboards from their one visit to another, or whether it could be the detailed reporting that they can read through on their own. But the accessibility of information is critical also for them. So the documentation leads into how you keep the consumer or the patient informed of their journey in the mix also. And, at HCA, we are investing a lot on modernizing our EHR system to make this very efficient process in documenting. So we have invested in Meditech Expanse, and CereCore is our critical partner in this journey. And we will lead into our first markets going live in January, and which will take us to our next markets in North Florida going live by the end of the year. And hopefully by then, we have a desired schedule for the rest of the enterprise to move into the Expanse world. And those are kind of investments. But, documentation takes us so far. And I think innovation also leads then into the automation of these back-end processes. And some of these key processes which require automation, we've done great, but we got a lot more to do, lead into like patient billing and scheduling patients efficiently on a timely from all different care settings. And there's a lot more work we are doing in that space. Patient communications, how do we inform them and keep them connected of all their care episodes and scheduling? Just the information, as I mentioned, we collect a lot of data in that patient care settings. How can we present those information and analytics around them back to the patients and the care providers? What are the key success criteria that we can present to make the efficient, timely, and impactful decisions in their care? I think all those things lead us to saying is, hey, prevention. What are we doing in the prevention? Because it's important to the caregivers and then to the patients also. The AI applications, which we are leveraging these days to just prevent the medical errors, and then kind of demand forecasting for our own staffing really provides better care for our patients. All these things lead into or are part of the big automation efforts, and they really play together in various areas very well. So I think that leads into a lot of different areas of automation and innovation kind of serving each other hand in hand.
Yep. No, you've mentioned an awful lot, and I certainly think that people that are listening that might not be part of large enterprise systems, even mid-sized systems, et cetera, are going to go, holy cow, that's a lot, and there's only a handful of us, only a handful of me, and so I know you've heard that that whole phrase saying that the whole is greater than the sum of the parts. And it's certainly not something that IT or a certain individual can tackle or do together. And you're in a unique position of being part of a large organization that spans continents, right? The United States, the UK. Talk a little bit maybe about just kind of the collaboration that's required to execute on some of the things that you talked about, not only internally, right? Because you've got lots of different stakeholders across the enterprise, but also externally, with partners, with folks outside of the industry that might even be bringing new ideas or fresh perspectives.
Yeah. So, one of the first things you got to tackle in this collaboration is the silos, which are inherent and they are non-intentional, but they do happen. So how do you identify the silos and try to bring folks together to collaborate, whether they are internal or external? You're going to run into both type of silos in the mix. So let's talk about internally. The processes itself, the workflows require a lot of collaboration and sharing in the mix. So you got to first start internally figuring out where the silos are and how you can approach them, and what are the values they provide by breaking the silos and working across. Service lines. I think another way of looking at the silos is the service lines get very narrow in the workflow, and the patient can need multiple service line help in their care journey. How do you make that seamless for them not to navigate, but facilitate navigating through? Better communication, better coordination of care in all different settings play a big role in that. Let's talk about external. How can you leverage partnerships which typically don't are visible in healthcare settings, but can be leveraged across? Like big Google platforms, can they leverage us in processing information and presenting information and the insight in a different ways? Partnership with Meditech on the platforms. I mean, as we are deploying Expanse, we are definitely looking at opportunities of creating insights for our own clinicians. How do they utilize the systems, and if they provide us the insights to help them most probably do things differently, organize workflows differently to be more efficient. Having those insights go a long way of most probably changing behaviors and breaking silos and reaching out and sharing a lot more information in care settings. And then, you always have to go and compare with external healthcare entities, and I leverage quite a bit Chime's work effort. I'm part of Chime's itself. Yep. HIMSS brings a lot of value in the mix also. And then everybody is looking at healthcare from a technology perspective, their own way of delivering it. And there is some learnings to be done when you look at consumer space and say how healthcare is getting delivered. Needless to say, COVID have changed the paradigm the way we think, and we talk about it a lot. Since COVID, we are doing things differently, and nobody wants to go back, but go forward. And what that go forward means is really thinking out of the box in the collaboration space and finding partners which typically have not been in healthcare. And we will see more and more of these partnerships, but it all starts with having an open mind about doing things differently and having a good ear to listen to what we are trying to solve up front. And I think then it's just in front of us how you approach different problems when you have different partners in the mix.
Agreed. And I'm glad you brought up COVID. We've heard it time and time again across the industry, and certainly I believe HCA was no exception. It was a unique challenge for organizations, and it broke down a lot of silos, a lot of processes very, very quickly as folks kind of reacted, to this new normal. And I think, in some ways, it was a challenge that was taken on to say, okay, how do we do things different? How do we do things faster? How do we, kind of move things down the path? And collaboration is key to that. So, are there some of those areas where, HCA took a look and took a different approach as a result of COVID from an innovation perspective that have now kind of become, I don't know if I would call it the gold standard, but kind of the new norm as you described it? So whether it be in process or in ways that we, that HCA kind of delivers care?
Just like everybody else, we had to pivot and figure out what it means to us and where the needs are. So you're exactly right. Everybody had to think on their feet and assess what information we had and where it's needed. So yeah, we at HCA, we did pivot it in a lot of different areas based on the needs. First of the big adjustment, we have the information. Now, what is the need for the information and how it could be presented? So NATE is a tool which was developed internally, and it's all focuses on the analytics for the treatment and efficiency. That's what NATE stands for. We created different views based on the need from NATE itself. And we start doing analytics on the information and presenting it to the clinicians in a timely fashion to react on, and really focusing on COVID itself and what COVID protocols were in the mix, and how they need to be the patients need to be treated based on the information we were collecting at a very fast pace. Every bed in HCA Healthcare system, was being assessed to say how it could be leveraged for COVID patients, as you know. And then, so we had to make all these information available to our clinical resources so we can optimize the resources and any other clinical protocols to be leveraged there. One other example is, the COVID ARDS, which is acute respiratory distress syndrome, that just the clinical protocols around that to make them accessible to all the intensivists, the therapists, nurses, and ability to monitor closely the patients which were going through these protocols. And it was like how quickly you can analyze the information and present it back in a timely fashion. And that happened over and over again. And that has been, the information is always there. And sometimes you just have to innovate the way you present the information itself and make it more relevant and make it more dynamic to be able for the clinicians to respond to. So NATE served as a great tool, which has more demands coming for it to be responsive to, and we changed views just to be more responsive in that providing the information on a timely basis. Vaccine management became a bigger initiative. I mean, everybody had different ways of providing the vaccinations and tracking them. But COVID vaccinations created its own challenge. At the last minute, we used the PEGA as a tool to create the vaccine management across the enterprise and being able to deploy it in 60 days across all functional areas in the organization. And that was an iteration also. Needless to say, week 1 was difficult. Week 2 got better. Week 3 got excellent. Week 4, it was a running machine across the enterprise. So you just work through the challenges and become very innovative in addressing those challenges in a short period of time. And there's a lot of team members which need to be commended on responding to in very short timeline to address these needs.
Yeah. Well, I know certainly that, and you all, HCA is no exception, and we saw it across our client base as well. IT organizations just really stepped up. And I think it was what COVID did was re-emphasize the focus that we all know is there, right? That what we're doing is not just IT, but what we truly are doing is transformational in the delivery of healthcare. And I believe COVID was that, I would almost go so far as to say refresher for some IT organizations to really bring it again to the forefront in a critical, urgent fashion. And, I got to tell you, seeing and hearing what you and your team have done and some of our clients have done is it's been exceptional. And one of the reasons why I think so many of us have chosen healthcare IT is that chosen path, because it's very different from IT and manufacturing or distribution or anywhere else where a widget's a widget, and this is people, and there's something different about that mission for sure.
Exactly. I think one of the most exciting part is that this is not healthcare IT is not a boring space. There is a plenty of challenges, and if you are the type who like to be involved in solving problems and dealing with a challenging environment, healthcare IT is for you. But it is a mission you sign up for. And it just keeps you on your feet of thinking through the next problem. And what COVID did was we most probably were always trying to catch up with the next problem. what COVID has done is made us think about the next problem and trying to be prepared for it. So it's making it a little bit more proactive in thinking about what the next problem could be and getting ready for it. It's making us it has made us very adaptable also with the same or different constraints to be more responsive. Healthcare IT, we never thought we can do it remotely, am I right? So we are doing a lot of this remotely by leveraging the technologies. Telehealth is a great example of that innovation. I mean, needless to say, it has been there, but the adoption of telehealth required some innovation.
That's right.
How do we make it happen for such a large scale in a short period of time? And that was pretty much determined from a pandemic nature of it. So the post-pandemic, we are still looking at the next problems. We're still focusing on the next challenges ahead of us and trying to bring innovation front and center and helping us tackle them. And I think that's what is needed to keep moving forward.
Agreed. Well, Shahzad, certainly appreciate your insight today. You know, we always wrap up these sessions with almost just an open question. You know, and it really is, you know, what advice do you have for, you know, others in IT from a healthcare perspective? You know, lessons learned, et cetera. What are maybe those top couple of items that, you know, when we talk about innovation, when we talk about what they should be looking at, thinking at to set themselves up for success in the future? You know, what are maybe a couple of those just golden nuggets that you might have to share with the rest of the viewing audience?
I think one thing I keep in front of me all the time is stay attuned to your customers, the clinicians, the patients. You know, they attribute their experiences with us to what they experience in their life with other conveniences. And how can you be innovative and making sure you're delivering at the same level where they get other things done? For example, banking. For example, their own other day-to-day activities. Healthcare needs to be just part of that, fit into their normal routine of how things get done. Second advice is think of what they will be asking for next. And it's all about an experience. A care setting experience is all about, can I take them from one setting to another without having them to struggle through it? Can I schedule something for them? Can I inform them? Can I fill the gap by getting their medications there before they get there? All these conveniences are critical for us to making the connections in our business. And third, and most probably important, is there's just always a constant change, and be open to it and be receptive to it, and just mature through it. You don't get to the perfection, or at least close to the perfection, in the first attempt. It's a journey, and you have to go through it, but be open to it. That's a step one before you can mature through it.
Oh, great insights. Well, Shahzad, thank you so much for your time today and your perspective. And I know that it will be well received. And so thank you again, and appreciate it.
Well, thank you for the time.
All right. Thanks for listening to the CereCore podcast. If you like this conversation, check out our other episodes. Visit us at CereCore.net to learn more about our IT services, and connect with us on LinkedIn. At CereCore, we are healthcare operators at heart and know the difference that the right IT partner can make in delivering quality patient care 24/7. Let's help make IT better. Here's to the journey.